Miscellaneous needs of the aging. Skin integrity and the functional ability of the feet are essential for well-being. With loss of skin elasticity, wrinkles appear and sagging tissues are apparent. Exposure to heat, cold, water, trauma, friction, and pressure can affect skin integrity. Different problems that we see in the elderly can be xerosis, which is extremely dry, cracked, and itchy skin. One way to deal with this is to decrease the number of baths they take, doing the sponge bath in between a full bath. Purpura is the extravasation of blood into surrounding tissues. It's frequently seen in the dorsal surface of forearms and hands as those reddish purple spots. Age spots and lentigo, or freckles, are usually smooth, brown, or irregularly shaped spots, and you see them most on the hands and the forearms. Angiomas are small, round, red or brown lesions. These are benign tumors that have blood vessels in them. Seborrheic lesions or keratoses can be irregular, round or oval, brown or flesh-colored lesions, or skin tags. Skin lesions, make sure that you rule out skin cancers such as melanoma, which is the most dangerous, basal cell carcinoma, which is the most common, and squamous cell carcinoma, which is the second most common. Yeast infections are very common in the obese, malnourished, recipients of antibiotics or steroid therapies, diabetes. They're found in moist, warm, dark areas such as skin folds, axilla, groin, or under pendulous breasts. We also see yeast infection in the mouth, and this is oral thrush. It's associated with poor oral hygiene and immunocompromised clients. A lot of women will begin to see facial hair growth, especially those that are postmenopausal. And nails, again, become harder and thicker and more brittle and can begin to change shape. These are different ways of taking care of the skin. Pressure sores and wounds. Wound healing, if you remember, is slowed as we get older. Skin is thinner and it has less subcutaneous tissue, and tissues are more prone to injury from pressure or bumps. Moisture can macerate the skin, in other words, soften it and make it more prone to injury. We use the Braden scale to assess the risk for pressure ulcers. Functional ability of the feet is essential to well-being, as I stated earlier. Common problems with the feet can include hammer toes, fungal infections, corns and calluses, which are caused by rubbing of shoes or toe on toe. The treatment for corns and calluses would be pads, gel pads, moleskin, or lamb's wool to help remove pressure. Mild corns can be resolved if that pressure is removed. Over-the-counter preparations can remove the corn, but can also burn the skin. Surgical removal of corns may be required. Understand that well-fitting shoes are a must. And the other problem is bunions. Treatment includes corticosteroid injections or anti-inflammatory pain medications. May require custom-made shoes or running shoes, and possibly surgery. Age-related changes in elimination include decreased capacity, increased irritability, contractions during bladder filling, incomplete emptying, urinary retention due to enlarged prostate, and incontinence due to weakened perineal and bladder muscles. Gastrointestinal function changes. Constipation is the most common complaint. Impaction is common in the incapacitated and institutionalized older adult. Suppositories are not effective with impaction, but oil retention enemas might be. Excuse me. Fecal incontinence is continuous or recurrent uncontrolled passage of fecal material for a month's period. It can be transient or it can be persistent. It can be associated with UTIs, damage to pelvic floor, neurological disorders, functional impairment, impaction, immobility, diarrhea, and dementia. Excuse me. Genitourinary function changes include incontinence. It's usually underdiagnosed, it's underreported, and it's undertreated in the older adult. It is associated with falls, skin irritations, UTIs, pressure ulcers, and sleep disturbances. It can affect self-esteem and socialization. It increases depression and anxiety and interferes with sexual activity. Different types of urinary incontinence include transient, which is acute, so it has a sudden onset, and it has to be present for 6 months or less. Causes of transient incontinence include UTIs, delirium, constipation or impaction, increased urine production, or treatment and medication causes. Established continence or chronic incontinence can include sudden or gradual onset, and there's 4 different types. We have urge incontinence, which is the most common, and it occurs soon after feeling an urgent need to void. It's also called an overactive bladder. We have stress incontinence, which is associated with activities that will increase intra-abdominal pressure, such as sneezing, coughing, exercise, lifting, bending. This type of incontinence is more common in women, but it is common in men who have had a prostatectomy or radiation. Urge incontinence, mixed or stress with high postvoidal residual is the next type of incontinence. It occurs in bladders that do not empty normally and those that become overdistended with frequency and constant dribbling. You might see hesitancy in being able to start the urine stream, a slow stream, infrequent or small volumes of urine, feeling of incomplete emptying, large post-void residuals, and calcium channel blockers can contribute to this type of incontinency. And the last type of incontinency is functional and mixed. Functional is they're unable to reach the toilet due to environmental barriers, physical limitations, or cognitive impairment, but they do have an intact lower urinary tract. And the mixed is combination of more than one type, and this is more common in women. UTIs are the most common cause of bacterial sepsis in the older adult. It is more common in women than men, and you always should suspect a UTI with mental status changes. Taking care of elimination issues may require training. In other words, we have scheduled times for elimination or prompted elimination and elimination training. Kegel exercises can help, and teaching the client not to ignore the urges to void or defecate, and encouraging cautious use of laxatives. Diet can help by increasing fiber, increasing fluids, especially for bowel habits, and making changes in the diet to avoid gastric distress. Pharmacological issues might be limiting caffeine or the use of sleeping pills or sedatives because they can reduce the sensation to void. Take diuretics early in the morning, no later than 3 o'clock in the afternoon, but preferably noon is going to be the latest. Medications to decrease urination, such as Detrol or Ditropan, stool softeners or mild laxatives, suppositories, and maybe some alpha adrenergic medications for benign prostatic hypertrophy, and surgical procedures, which can include bladder suspension, prostatectomy, and a transurethral resection of the prostate, or a TURP. Regular physical activity throughout life is likely to enhance health and functional status as people age. It also decreases chronic health issues and improves health outcomes. It is important to keep the older person moving any way possible for as long as possible. In Healthy People 2020, gerontology basic goal is to increase the amount of physical activity of all adults. Every exercise program should be based on the client's medical history. Look at their cardiovascular history and their musculoskeletal history, and it should be individualized as to the client's ability. Endurance exercises are going to include continuous movement that is sustained for a minimum of 10 minutes, involving large muscle groups. You begin slowly and increase as endurance increases. Endurance exercises will increase breathing and heart rate. Examples are going to be swimming, bicycling, walking briskly, tennis, dancing, gardening, such as mowing and raking. Strength training is going to build muscle and increase muscle strength. You can do this by moving or lifting against some type of resistance, and it should be performed at least twice a week. Balance exercises will help improve standing and their gait and help prevent falls. An example of balance exercises are going to be Tai Chi exercises. Flexibility exercises will help keep the body limber and help increase range of motion. They should be performed at least 3 days a week. An example of this type of exercise would be yoga. An exercise program can be developed for most clients despite their ability to complete by themselves. These exercises can be integrated, or rest periods may need to be integrated into the exercise program every 2 to 3 minutes as the client needs. And you can also integrate some exercise into activities of daily living. Make sure that you emphasize the immediate outcomes or benefits that can be expected from regular exercise. And make sure that you explain the type of exercises the person should do on a regular basis, including safety tips for the performance of these exercises. Sleep is a basic need, and when we sleep, rest occurs. Sleep and rest will help the body conserve energy, prevent fatigue, provide organ respite, and relieve tension. This is a list of some age-related sleep changes. Sleep complaints are linked to other health problems and disorders. Insomnia is a complaint of disturbed sleep in the presence of adequate opportunity and circumstances for sleep. Diagnosis of insomnia requires difficulty falling asleep for at least 1 month and impairs daytime functioning. Classifications of insomnia include primary, where there is no other cause of sleep disturbance identified. This can include sleep apnea, and there are a couple of different types of sleep apnea. Obstructive is the most common type, and central, which is due to the central nervous system or cardiac dysfunction. Sleep apnea can be improved with weight loss, avoidance of alcohol and sedatives, smoking cessation, avoid supine sleeping, and a CPAP. And then we also have restless leg syndrome. The other type of insomnia is going to be comorbid, which is more common and associated with psychiatric and medical disorders, medications, and primary sleep disorders. It is more prevalent in older adults. We also see rapid eye movement behavior disorders and circadian rhythm sleep disorders, where normal sleep will occur at abnormal times. Biorhythms vary from individual to individual and with age. With aging, the natural circadian rhythm may become less responsive to external stimuli such as light. The amplitude of circadian responses will reduce with age. It is very common in older adults. We will see a loss of voluntary muscle atonia during REM sleep and violent behaviors while dreaming with potential injury to the bed partner. Sensory motor and neurological disorder characterized by unpleasant leg sensations that disrupt sleep is how we describe restless leg syndrome. It can have feelings of creeping, crawling sensations, tingling, cramping, burning pain, etc. in the legs. It's usually treated with antidepressants, neuroleptic medications, stretching lower extremities, taking hot baths, relaxation techniques, and the avoidance of alcohol. So how do we help people with problems sleeping? We start with non-pharmacological issues. Behavioral therapy, where we teach the client to associate the bedroom with sleep and sexual activity only. Relaxation therapy, with relaxation exercises, meditation, imagery exercises, etc. Temporal control therapy, where you maintain set times for sleep and avoid daytime naps. Sleep restriction therapy, where the time that is spent in bed is for sleep only. Exercise. Avoid exercise within 4 hours of bedtime, but understand that regular exercise will enhance the sleeping ability. Light therapy. Providing exposure to natural light and avoiding night lights. Limit caffeine. Provide a light snack or a warm beverage prior to bed. Maintain a quiet environment prior to bed, such as soft lights, quiet music, limited noise. Decrease interruptions. Medicate as necessary. If they're having pain, they're not going to sleep. Provide a comfortable temperature. Develop a winding down routine. Brush their teeth, read, have a snack, etc. And avoid the computer or television prior to sleep. And recommend that if they are unable to fall asleep, to get up and go to another room. Implications for gerontological nursing and healthy aging. Excuse me. Again, remember that adequate sleep and activity are essential to physical, emotional, and cognitive functioning. Sleep and activity needs must be met to maintain biological integrity.